And for the urgent referral letter, you have to keep two things in your mind to follow simple referral letter format for the cancer patient. Hello guys, this is again Dr. Faraz Ahmad, and in this video I am going to clear a very important query which a lot of people are asking me for a couple of months. Although I have cleared this query in my videos and I have cleared a lot of people in the comments and in the reply of the emails, but still people are asking me like, what is the difference between the emergency referral letter and the urgent referral letter? So in this video I am going to let you people know that what is the difference between emergency and urgent referral letter and how you can write both of these letters. So first of all, keep in mind, please forget about emergency referral letter and the urgent referral letter. You have to keep one thing in your mind, like if some condition which is mentioned in the case note is going to be life-threatening for a patient, then what you have to do, you have to follow the template of the emergency letter. And if that condition is not going to be life-threatening and it's written, please write this letter urgently, then you have to just simply follow the simple referral letter format. Let me further clear this point for you. If this is an emergency referral letter, it will be very clearly mentioned in the case note. You have to write this letter to the emergency doctor, you have to write this letter to the admitting officer of the emergency department. If emergency department emergency word is mentioned in your letter, you have to write that letter in the emergency referral letter format. So what is the format of the emergency referral letter? You have to write introduction first, then you have to write today's visit, and then you have to write rest of the visit just in a single paragraph. Please keep in mind, in emergency referral letter you have to write rest of the visits in a single very small and brief paragraph. And after writing the previous visit paragraph, what you will write? You will write social history paragraph, and then you will write the conclusion paragraph. Please keep in mind. And the people face problem when there is an urgent referral letter given in the case note. Please keep in mind, for the urgent referral letter, you have to keep two things in your mind. If the case which is mentioned in the urgent referral letter is life-threatening or not. If the case is going to be life-threatening, definitely you have to write the urgent referral letter in the form of emergency referral letter. So what does it mean? Let me give you an example. Like if it is given in the case note, someone has chest pain and it is given in the case note, please write an urgent referral letter. So what you have to do, you have to write an urgent referral letter using the emergency referral letter format, because this chest pain could be from heart and it could be life. In other type of cases, like it is going to be the life-threatening condition, if there is a case of the acute abdomen, there is a case of the acute pancreatitis, there is a case of history of fall, and patient is fit and fine, no problem with the patient, no fracture, no nausea, vomiting, no ENT bleed, nothing, but patient is on blood thinning medication. So this could be life-threatening as well. So what you have to do, you have to write this type of urgent referral letter in the form of emergency referral letter. So the biggest difference and the biggest problem is this. I used to face this problem as well when there is a case of cancer. So what we people think, like cancer is the biggest emergency in this world, but it is not an emergency in the United Kingdom or in the Australia. Cancer is not an emergency at all in this country. So what you have to do, you have not to write the letter, you have not to write the urgent referral letter for which diagnosis is cancer in the emergency referral letter format. So how to write a cancer letter? So please keep in mind, while working in the United Kingdom, while working in the Australia, the protocol being followed over here is that if you are suspecting a cancer in some patient, what you will do, you will send that patient home and you will write a 2-week wait referral for that patient. What does it mean? Like within 2 weeks that patient will receive a call or the patient will receive a letter that you are called for an appointment to this doctor. So this will be basically referral letter in the case of cancer, and that is 2-week wait referral. Patient will wait at home for the 2 weeks at least. So please keep in mind, cancer is not an emergency at all here in this United Kingdom or in the Australia. So if cancer is mentioned in the case note, this should not be emergency for you as well. So if cancer is suspected in the case note and it's written, please write an urgent referral letter to some other doctor. So what you have to do, you have to follow simple referral letter format for the cancer patient. This is very important point which you have to keep in your mind. Let me repeat all this video for you. If there is mentioning of the emergency referral letter, or there is mentioning of the emergency department in the case note, you have to write that letter in emergency referral letter format. But if there is some other case and it's written that please urgently refer this patient, so what you have to do, you have to think from your medical knowledge, either this condition is going to be life threatening or not. If you think yes, this condition can be life threatening, you have to write this letter in emergency referral letter format. But if you think, oh, this condition couldn't be life threatening, then what you have to do, you have to write that letter in simple referral letter format. So I think I have cleared your point. If you still have any queries, you can ask me in the comment box. You can follow me on the Instagram to ask any of the questions regarding the OET, regarding PLAB 1, PLAB 2, visa status of the United Kingdom or the NHS jobs. Thank you very much for watching the video.